doesn't usually take this
Oh,
long.
we're live.
Oh, hey,
It's
you
live.
guys, we're live. However, our like amazing PowerPoint deck is not live, and there are maybe because it's so large because so much happened this
What
week.
do you mean? It's on the screen, Kat.
I don't see.
It's literally on the screen.
You were just pressing buttons. It's there.
Stop.
Go back.
Kat,
Wait.
stop. What are we doing? Stop.
I don't see it. You know what? I'm gonna
It's
leave
on
and
the
come
screen,
back.
Kat. It's you, not us. Oh my god.
That probably is me.
I'm removing. Here we go. I'll take care of the slide.
Here, you guys keep talking. I'll be right back.
Oh boy. Kat's having more technical difficulties than possible. As it happens. Welcome to the Health Tech Talk Show. While Kat tries to get connected. Hi, Melissa. Hi, special guest Brian. Kat is about to rejoin us, and we are really going to start the show. It's going to be amazing. We swear. The deck in particular is there's a lot in it this time. There's a lot of
information today. So
there's a lot.
I think it's just causing some, more technical difficulties than usual. Here's Kat again.
Yeah, here's me, but I'm not here because this is a load of bullshit.
What's happening? Kat, what is happening? Oh my god.
So anyway,
okay, while we wait for her to do that, Melissa, tell us what's coming up. Tell us about Vive. Tell us about sponsorships. Give us all the good stuff.
Okay, guys. So we will be attending ASTP ONC meeting and having a live show following that, hopefully with some guests from said meeting. We will be having a live as well and at HIMSS, looking for some sponsors, but some are coming through. So please make sure that you reach out to me ASAP so that you don't miss the opportunity to have a live sponsorship show of these great events. Today we are having the magnificent Brian Lane from Wellinks, a friend of the organization, and has lots of things to say. Have no idea what that will be because, as you know, we are live and unscripted. And that is pretty much all of my updates on what we're doing in the future. However, I do have the deck available, Lisa. I don't know if you want to speak on it while Kat gets on and we can kick Brian off for the time being so that we save any reputation so that we don't say things that he doesn't necessarily agree with.
Or I can read your slides and try to interpret it and then push that message out to everybody.
How about you just give us a little introduction on yourself, who you are, what you do really quickly before, I kick you off and try to pull.
Perfect.
Fine. But first what I'd like to do is I would like to commit. I'd like to be one of the first people that actually just responded to you, Melissa, because I think the world of you in having one of our team members from Wellinks actually provide live coverage at Vive as well as HIMSS. Not that I was listening, but I am listening, and I'm telling you flat out, we will have people there, and we will at least have one speaker for each of those events for you. Okay.
Oh God, Kat, you're killing me.
I will be in touch with you.
Complete failure. Complete failure over here. I apologize.
All right. We're sending Brian back. We're gonna send Melissa back too. Everybody is off stage. I'm gonna bring up our slides. I have to run them because Kat does not have internet in Georgia. Georgia does not do internet. We've learned.
I was also part of that massive Verizon outage. That was cool because me, I was definitely I'm the only one who's having this problem, and then it turned out it was just me and half of America. So that was cool.
Yeah, it was actually really funny because it happened during JPM, which we will talk about. And there's 150,000 men in Patagonia vests wandering around San Francisco, going from meeting to meeting, and they most of them didn't have cell service, and it was kind of funny. I enjoyed it.
Okay, so I was thinking, I landed from JPM and my phone just didn't turn on, and I was thinking, once I found that it was half of America, I was like, man, how do you even call an Uber?
You don't. You don't.
What, do you have to find a taxi?
Perfect.
Cab? What even happens? Yeah. So. I'm glad that all worked out, but yeah, it wasn't until mine didn't really turn on until the next morning or when I woke up, who knows when, but I don't know.
Great. Okay. Everyone, Kat is joining from her cell phone. This is the Health Tech Talk Show, as noted before. Special guest coming up in a little while, Brian Lane. This is our beautiful graphic where I think we're being eaten by the bald eagles, which is probably appropriate.
We are. Correct. Yep.
All right.
Yeah. So
So
very cool.
I've just advanced. Can you even see the slides? You can't. I'm gonna have to tell you
No,
what's on
I
them.
can see the slides. No, I can see the slides.
Okay.
I'm just saying I left this one in because this is the secret one that I missed last week because you updated. We had more technical difficulties, so I wanted to give you the opportunity.
No, I was just saying, like, this dude is like super. He literally runs the sovereign wealth fund of Norway, which, if you didn't know, Norway has a lot of money, a lot of oil money that resulted in a massive sovereign wealth fund, which they invest and whatever. So this dude was like in charge of it, or is in charge of it. And then he decided to start a podcast and became known the world across the entire world. And I was thinking, yeah, we should also be this famous cis dude. We did not run a sovereign wealth fund, but we're probably better podcasters than him. At the end. That's
I
it.
feel like we're I mean, I guess like what makes a good podcast? I don't know. A discussion for another day. I don't know. I don't know.
Exactly, exactly. Anyway, just an
Oh my God.
aside, just an aside. We have lots of news, Kat. This is. You want to start
We
here?
do. Yeah.
This is the place.
Yeah. So, okay, America, not sure anyone noticed, but Epic came back and sued a bunch of companies. I think Health Gorilla is the one we all know. I will say, like, I did like vaguely read through the filing. Um, every single one of these companies, most of these companies, not all of them, most of these companies are named after animals like Health Gorilla, Llama Lab, Mammoth, Guide Dog. Like, oh my God. So, and it like, listen, like Lisa, I'm sure you have because it's you. Have you actually read what Epic sent in?
No, I just read the excerpts from Brendan's post. I don't
Okay.
have time for that.
Okay.
I don't
It
read
is like,
lawsuits.
oh, me neither. But this one I skimmed through and
What do I look like?
you guys, yeah, what do you look like? You look like the person who tells me everything. Shut up. What? I'm surprised. Anyway, like if you it's like this like twisted tale of like crazy connections and like at one point oh, we should also say AI made this graphic for us obviously. I just wanted Epic with a bunch of animals um that were after all these company names, but Epic didn't sue on their own. They sued with a bunch of health systems behind them, including like this health system, like things like Ocean. Um, like I can't even describe to you the twists and turn. I can't keep it straight, but apparently, like all of these companies are related. And then I
Well, it's
think
just
like
alleged pervasive criminal. Allegedly,
yeah, it's all
allegedly,
to be
allegedly,
clear, it's all alleged.
pervasive criminal behavior is the narrative they are selling. They're saying, they got caught here, they spun up a copycat entity right there and started pulling data the
Right,
very next day, right? And
right.
like, I just, what they're alleging, the narrative they're putting forth is that there was just like a ring, like a pseudo criminal ring doing this work for high profit. So I just, again, all this is alleged in this lawsuit. Like, we'll see how it shakes out, but I can't imagine that they would have filed this lawsuit, and the health systems as well would have filed this lawsuit if they didn't believe they had strong evidence this was actually happening. So yikes.
Yeah, it's like incredible. And like at some point in there, it's like something like I guess all these companies are like, oh no, so and so is not, we're not related to them, or we don't help them, or whatever. But then like there was
It's
some
like the
deep
same
search,
person
but there were
or
yeah,
like
there
a
was some
family
yeah, like
member, like
yeah, it's like, and then at one point, like
right.
they were saying, "Oh no, no, we don't even know that guy." But then that
Uh-huh.
guy is in a picture as like a groomsman at one of their weddings. Like it's like insane. And then there's like it's just like totally wild. I
It's a lot. It's a
yeah,
lot.
it's a lot, and there's a lot of like, no, we've never met. And then also the Integratort CEO is also involved with another one of these companies. Like you
Mammoth.
guys,
I think it was
is it
Mammoth
Mammoth?
that, yeah, yeah.
OMG, hold on. I'm gonna actually try to come back on the internet. Let's see what happens here.
No, no, no. It's gonna break. It's gonna break. Don't do it. Don't do it.
Oh,
Yep. Now you're
here I
gonna
am.
double mute or whatever.
Don't, Lisa, don't, Lisa.
Okay, well, Gary, you gotta switch yourself or what? Okay.
Oh, that is a horrible picture of me. Oh my God. Okay, we're back. Anyway,
what's going on there with your
moving
cord? There you go. Okay, fix your cord. It looks weird.
I don't know what to tell you, Lisa. Oh my God.
Okay, so that's the epic sitch, and then they put out Health Gorilla put out a immediate
Yeah. So
release.
this all came out. So I think, listen, I'm just like, I have a lot to say about this. So first of all, I know Health Gorilla had been like, allegedly doing shady shit in the past, or according to the internet, and rumors. Who knows if that was true? I was really excited that Bob Watson, like that guy's like legit from Javari, took over as CEO of Health Gorilla. So like, I kind of hope, if this is all true, that like maybe it happened before him and he wasn't involved.
Yeah, I
but
mean,
Health Gorilla
unfortunately,
says,
that doesn't always protect a company from a liability perspective, but we'll see.
I know, but I just really like him. Like I thought he did a good job with Javari.
Yeah.
So that's just my.
I mean, clearly
feeling.
something went down at Health Gorilla because as we know, nearly every single person on the prior team left. People
turnover.
left. Yeah, and so I think that I don't want to say there's smoke, there's fire. Remember, everything you hear is alleged in a lawsuit by very powerful companies, but like that doesn't look great in terms of like nothing bad happened. Something bad happened.
I think something bad happened. Yeah.
Yeah. But we do, to be fair, again, we do believe very much that, the people who work there now are working in the straight and narrow as far as we know, right? Like there's no, yeah.
You know what I disagree with though? I don't remember what the next slide is another epic thing. Just about like the incredible perception that is being created by this. Like there's bad stuff going on in the national networks, like patients should be scared of what's happening with their data. Honestly, I think that's true. Like, I think they should know what's going on with their data. Most of us have no idea what's out there.
I think they should know what's going on with their data. I do think everyone can just take a little breather here and understand that a company that is not particularly excited about data liquidity has identified a number of ways to sow fear, uncertainty, and doubt about that. I do not like it when people, I also do not like it and do not want people to profit off my data for things that are stupid. But like, I think there is a very clear campaign here, some legitimate, some not, about the fear, uncertainty, and doubt about, data privacy, medical privacy. Because, and I think this might be the next slide, maybe, where we're talking about our friends at, I don't know either. Hang on. I'm just gonna go. Let me see if I can find it. No.
Oh, you didn't have it. All of our juice.
I know. I am. Okay, never mind.
I don't even know where it is.
Anyway, this week we also had the HealthX and Claude and the expansion of the OpenAI. Like, so on the one hand, you have Epic being like, your medical privacy is at risk, and then the other one is like, OpenAI says, give me all your health data with no HIPAA protections. And everyone goes, yay! So, I mean, listen, like, you can't have both things happen at the same time. Like, I understand. I'm not even mad at Epic for doing this. Like, I understand, I understand why it would be beneficial for them to sow this, fear, uncertainty, and doubt. And it's, I guess all's fair in like love and war and business and whatever. But like, we can't have, both those narratives are conflicting, guys. Sorry.
Yeah, well, I don't get the impression. I mean, there's nuance there, right? I don't get the impression that Epic is anti-individual access, though. I think they're anti-companies taking data to build. I don't get that.
Can I play the LOL emoji for you right now? Because yes, they are. Yes, they are.
I don't think they are.
Because the IAS can legitimately be used for. They have done plenty of things to push back against IAS and make it not work. And really also, they're fine with individual access as long as it means that you log into your MyChart account and do everything on MyChart. They do not want login and portal free access for individuals. Like they have, I disagree. I wholeheartedly disagree. They are fine with people living in their walled garden, and that's it.
I don't know. I disagree with that. I think they've made some moves to move it along.
We disagree.
I also don't know. I truly don't know. And this is going to piss off a lot of patient advocates. I don't know how much mass demand for that service there is. Like truly, I think it's a tricky market. That's why a lot of D2C patient access apps fail. That's why they all think the government should fund them, right? I think
meaningful use for patient apps, baby.
Yeah, go away. But I don't think they're anti. And whatever, we can disagree on that, but. What I do think they're anti on is companies siphoning off data for, even if it is valid treatment purposes, and then holding it for secondary use and selling it to health plans, which is exactly what they're all doing. And it's
The
cheap
American
data, right?
way.
Like patient access, you will not get the scale you need to sell to any sort of risk-bearing entity to make money, which is what they're
That's
all
right.
doing, or even research with
That's
individual
right.
access. You just won't. So
That's
I
right.
think this is more about, I mean, if you read that complaint, like it's some real shady business. So, and like kind of hilariously, awesomely bad.
Yep.
Yeah.
All right.
Yeah.
We got to
Moving
keep
on.
going. We have a lot to cover. JP
You're at
Morgan.
JPM. This
Yeah.
article is just hilarious. It was just really funny. It was about how most people have been to JPM but have never been inside the JP Morgan conference, which I think is super funny. Yeah.
Yeah. At this point now, I have been inside. I've been inside, but like, but only on someone, only sneaking in a way that will probably make JP Morgan, the company,
It will get
put an
you
APB out on me.
unincluded from the rest of them.
That's right. That's
we
right.
Know
That's
it
right.
exists. We know it exists. I mean, I've been to the lobby. I ate at the $150 minimum lobby restaurant.
That's
So,
right. They're just
you know.
they're just business presentations by CFOs, CEOs, whatever.
Yeah.
It's fine.
Yeah.
Nothing that exciting.
Also, Kevin O'Leary went, and apparently you can buy his coverage for like not much money.
Yeah.
So go buy it. Kevin O'Leary from
exactly.
Health Tech Nerds. Yeah. Anyway, we had fun. Lots of fans there. Yeah. Lisa had a great event. I think that's on the next slides here. Oh yeah. Lol.
This I had to laugh about because, first of all, Nikhil was a moderator on one of the other panels at the event that the company I work for put on. And he did a great job. He was hilarious as usual. His panel was a little bit wonky, but he made it work. And then he wrote this on the Twitter. And the person who said this at the JPM panel, which was the panel that I moderated, was Dr. Tom Keene, the Assistant Secretary for Technology Policy and the National Coordinator for Health IT. And he made a hilarious joke that everyone laughed about what, how AI agents are actually going to be working in healthcare, is that they're going to operate the fax machines. And that was funny. And it was very timely and everyone laughed. And that was Dr. Tom Keene, Nikhil, not just someone. And it also wasn't just a random JPM panel. It was me. It was mine. Thanks.
Yeah, well, okay.
Thank you for your attention in this matter.
Glad we have this talk show to make ourselves the most important things on the planet.
That's correct. That's correct.
No, but I'm sorry.
Well,
but
you just skipped my
I was trying to get
pictures.
to your event, Lisa. Your event was awesome. You had great panels. You had a great crowd. It was like all of our friends.
But here we go. Here they are laughing. Everyone's having a great time. This was the last panel. We were all drinking. It was all good.
Your panel was the most fun.
It was.
Sure. It was. It might be because of the timing too. It might just be because of the drinking.
Correct.
I don't know. But I had a great time there.
We had a great time.
Greatest party, just because I know we previously have talked about greatest parties. I love the Define Town Hall Oxyon party. I know I've been to Define.
Yes, Catherine, it was a joke by Tom, and he knew his audience, and we were all laughing.
It was a joke, but a funny joke. You're right.
A good joke.
But yeah, the Define party is always super fun. Great crowd. I love it. It's also later in the night, so you can like go eat food and like do things and then still have a good time. So that was the best. Always my favorite. There were also like a billion feds at this event. Like I wrote a LinkedIn post today saying like JPM for me was just a really expensive trip to DC. Yeah, but got to see everybody as if they were all in town up in
That's
up
right.
in DC.
That's right.
So that's great. Yeah, it was a good time.
Awesome.
Yeah. Oh yeah,
Cat.
And then we got the great healthcare plan, which is actually called that.
It is called the Great Healthcare Plan. There's some analysis in some one of my internal chats was that, obviously, if you know the lore of the healthcare plan the president's been talking about unveiling, it's always like, what's your plan? What's your plan? When's it coming? And so here's the plan. The plan is not much of a plan, but also kind of the analysis was, hey, this was released to sort of pressure Republicans to not sign the ACA subsidy extension stuff, which did not happen. Like, spoiler alert, like there is no extension of ACA subsidies. Health insurance is still very expensive on the individual market, got more expensive. It's not getting cheaper anytime soon. Some of the things in this plan is basically just telling Congress what the president wants them to do, and we'll see if they find a way to do this. But this plan on the White House website is very far from a bill or a law or something implemented, and TBD on all that.
I don't really get it. Like, is it just like, it's just kind of packaging up some of the stuff they're doing.
Here it
There's
is.
like nothing actually happening. It's all like, yeah, like, okay. And also, I mean, generally it's like, hey, we want to lower not external factors, but like not core cost issues. Like we're going to lower drug costs. We're going to like help out with cost sharing maybe. But also like the big part here seems to be another push toward consumerism in healthcare. Like we're going to give people HSA dollars only if they're on the exchanges. And somehow that is going to drive consumerism in healthcare.
I can tell you that does not work because I have a very big HSA. Yeah. Yeah. I think consumerism in healthcare only works if I can really negotiate my costs and if my insurance company actually gives two shits about what I actually pay either. If you have a high deductible plan, you go out there and you try and get healthcare. What happens is that you get the negotiated rates from your insurance payer, but then you just have to pay whatever that cost amount is up to your deductible. So as I famously say to myself all the time when I scream about my primary care practice, if I want to go and have like a 5-minute conversation, it's $800, and that's just what it is. And the insurance company doesn't care that it might be coded incorrectly as like mild or moderate or like, you know, like one problem or multiple problems. They don't care, so they just all pay. And you pay.
Yeah, I think it's uncool. Also, this is like back to my world famous rant about how patients are not consumers because consumers imply that they have choice and discretion and can like compare prices. And I know we've got like some of these not totally implemented things like hospital price transparency, blah, blah, blah. But here's the thing, like, here's the reality. If you've got cancer and they tell you, you got to go figure your fucking shit out ASAP, you're not going to be like, oh, let me sit around and compare prices across the country and see what works for me. And how much money do I have in my HSA? $1,000. Oh, that's going to do jack shit, right? So
I like how it's I like how it says post prices on the wall under price transparency. There's a little bit of complexity there, and I love it. Let's do it. Let's have everyone pay Medicare prices. Good.
Yeah.
Okay. Cool.
Yeah. I mean, this is where I go back to like this is where I turn into Lisa here. Medicare for all. I know you say Medicaid for all. Medicare for all.
I don't care. Whatever. I'll accept
honestly,
either.
That's kind of what's going to work. Something catastrophically tumultuous for our system, but you know what do I know? I'm just a grown internet.
Fantastic.
Okay. Moving on. Oh wait, that was good. This is I saw this. This was who put this on? This was on Health Tech Nerds. Someone posted it. I just totally freaking forgot her name. But she's a prolific poster. I was like, yeah, this kind of feels like that plan. That kind of feels like we're going to give you $1,000. You're going to be good.
Not really. I'll let you advance the slides now that you're back. Go for it.
Okay. Sorry. I'm just like used to it. Also, just wanted to note John Gorman, who has had some more angry than normal posts for the past couple of years here. Just want to say he posted something very positive and we were uplifted.
Very surprising.
It was so positive that we included it in our talk show. He's basically saying, be positive, good things will happen. Boom.
No. Oh boy.
Fraud is apparently still happening in Minnesota. And they received a visit from our leaders.
I just think this photo is so funny. Like, what is happening here with Dr. Oz mean mugging and Jim O'Neill smiling? Like, what are we doing? Like, what is the vibe of this photo?
Right. Well, what's so crazy is like I feel like Dr. Oz is seen like from everything I hear, he's seen as a very good leader, like good guy.
Dr. Oz, just smile. It's if Jim is smiling, you gotta smile.
And then Jim O'Neill, who I don't think we ever see smiling, is like smiling and kind of looks like he's at like a writers' conference. Like
I know he does. He looks so very the scarf, like very
like positive vibes. I don't know what's going on here.
Jim, what's happening?
Interesting choice to post this on the internet. But yeah, I guess we're looking for the pirates in Minnesota.
That's right.
And several other blue states, but not the red states.
Aye.
Yeah. Also, apparently, this is going on in LA County specifically.
So Alan is a really good guy I know from Maryland, and he's working in the hospice space now in LA, and he is just like there's a lot of stuff going on here. There's a lot of fraud, a lot of waste, a lot of abuse. And he's been just another example, right? When people start looking into this and really start applying some rigor, they are going to find a lot of people taking profits where they shouldn't and, doing, unethical and potentially legal things. So I think it's good, right? I really think it's important that we root out some of this stuff. But just again, I'll remind everybody, this is an example from LA, that's in California. Totally get it, but this stuff is happening all across the country and all the states.
Yeah. Yep. Okay, so big wild news that was super uncool that happened this week for I think less than 24 hours is many universities that operate academic medical centers, community health centers, on the ground recovery centers received cancellation notices from HHS, from SAMHSA specifically, saying that their grants were being terminated. Discretionary grants were being terminated, and they were being terminated for not being aligned with the administration's priorities. Wow, this was really bad. This was super devastating. People were going to have to shut down overnight. These were on the ground clinics that help people who were battling addiction, like really important community programs. The tribes, the tribal suicide prevention programs for teenagers and children, like all of them received cancellation notices. Estimated $2 billion in grants were canceled overnight. I think people told me they got their letters at like 10 p.m. on Tuesday night. The word on the street was like, yeah, they just all got canceled because part of it is moving SAMHSA into AHA, the Administration for Healthy America. This I was like, I just didn't get it. Like we tried to get some intel. Everybody was like, I don't know. They're just like, it's just awful. And no one could really figure out exactly what was going on. We did hear that, they're going to issue new grants. You have to apply. Also, make sure your website doesn't say harm reduction. Well, like this genuinely was awful. And then less than 24 hours later, the decision was reversed and all grants were reinstated. So everybody was like, WTF, what happened? There wasn't a ton of detail other than Congress taking credit for doing this. It turns out that Congress actually did do it. I have to see if I can share my screen here, but we received, everybody was like, how did this happen? First of all, it was like really big impact to communities. So, everybody noticed it's on the ground stuff. It wasn't like all this money was going to Deloitte or Mathematica or whoever, some big prime. It was going directly to community facilities. But it turns out, based on a semi-reliable, sometimes anonymous source, that this gentleman, Al Guida, who is a lobbyist for multiple companies, but I think specifically NetSmart is how we all encounter him. He is responsible for saving America.
Good job, Al.
Good job,
Big
Al.
ups.
We don't really know
Big
you,
ups.
but like when we see you, we would like to buy you a glass of wine. Holy
That's
shit.
right. A bottle of wine. Shit.
Yeah, a whole bottle. Maybe
Whole bottle.
4. I don't know, but let me see if I can share my screen. I might totally screw this up.
This is worth a whole bottle. So if the show goes down, everyone, just stay tuned.
If the show goes down, I apologize in advance. Hold on a second. So this is worth sharing. This is the letter that was sent to Secretary Kennedy. That apparently, accordingly, allegedly, some people have told us Al Guida stayed up all night and coordinated to get done. It's a congressional inquiry. I would just like to show you the signature pages.
There are a lot of pages.
And again, this was all less than 24 hours. So these are all members of Congress that signed on to this letter that apparently Al Guida pulled together and coordinated. It's a lot. And the letter is not like, I just think it's like a masterclass in like cool shit, getting people to do stuff. I don't know if you can read this, but given the urgency, it's basically congressional inquiry. Given the urgency, we ask that you provide the following information by January 16th, which is today. Remember, this happened a couple of days ago. How many grants were terminated? What programs were included? What was the rationale for each termination? Each termination, to be clear, please explain how each program, quote, no longer effectuates agency priorities. The president recently signed the Support Act for patients, blah, blah, blah. Of the grants that were canceled, please provide a justification as to why these grants do not align with the direction given under the Support Act. This is the freaking best congressional inquiry I've ever seen in my life. And
it's one letter. It's one page of a letter. They're like, do these things.
And it's like, you have to respond by January 16th, and you have to give an explanation for every single grant, of which I think there were almost 3,000, 2,800, 3,000. I would have reversed them all as opposed to doing this work too. So Al Guida, don't know you. I salute you, sir. You're a freaking champion. Back to our regular scheduled show.
Great. Good job.
All right. ARPA-H announced a new model. I think, Lisa, you attended more of that session than I did.
I did. The ARPA-H is still kicking, putting out new stuff. This is about building a clinical AI agent for cardiovascular care and a bunch of other stuff around it, which is kind of cool. So they had their big announcement. There's a whole thing happening next week, and they're moving into that space, that sort of frontier space of like, what would it be? What would it look like to get AI involved in clinical care at the cutting edge? And scary, but could be interesting. I will say the people who design these programs are medical doctors and specialists, so they're the freaks on the outside who are trying to pull everybody into bringing AI into direct clinical care. I salute them for their bravery and hope it goes well. It looks exciting.
Yeah, I think there's a proposers day next Friday, which you can find on the internet if you're interested in going to it. So cool stuff. This is what you were going to say. We're going into AI land, Lisa. So
So our friends at HealthX, Priyanka and team, they also announced, I guess it was on Sunday this week or something like that. It was like very recently. Kind of a similar thing similar things to the OpenAI and BeWell announcement with Anthropic Claude. There are some differences in the way it's set up and the authorizations and where the data lives. I think HealthX, their argument, Anthropic's argument is that it's more privacy preserving. I haven't totally evaluated, so I'm just repeating what I heard, just to be clear. But again, another way where people can bring in their health records through the individual access pipes, essentially. And just like with other things Anthropic is doing, and they're trying to make it more specific to like actual research or clinical care or whatever else, not just like, I want to just ask ChatGPT what kind of rare disease I have or whatever.
Yeah.
That's cool. But
cool,
shout out.
Cool. Shout out to those guys. In other AI news, Lisa, I think you told me about this in an Uber ride. But basically Apple's like, oh, never mind. We're not going to do our own AI. Gemini's better. We're just going to use that.
Yep.
That's the move. And then OpenAI bought a company,
Torch,
whose name I totally forgot, but is the same company that the Forward Health right after his company failed.
Kat, you froze there. I don't know if you could hear us, me specifically, but Torch is the company, and it was like I think it was like a pre-revenue, mostly pre-product company, pre-users, and this was the same dude, Adrian Ayoun, who started and then like out of the blue shut down Forward. I think at the time we talked about it years ago now, like leaving patients in the lurch and just being like, peace, deuces. So you know what? If you do bad, good things will come to you is kind of what I can say here. Congrats, mazel, you crazy kids! Like, hope you enjoy your hundreds of millions of dollars.
We're working for every dollar, billing for every hour. Jesus Christ! Oh my God,
mazel.
Okay, we're almost at the end here, and then we're going to move to our special guest. But did want to shout out, the CMS ecosystem. This
Kat, your internet's busted again. Kat, your internet is busted.
Seriously? Can you see me?
You just go in and out. NCPDP.
Okay, talk about this.
NCPDP, our friend Pooja is just announcing that NCPDP is in the pharma interop space through Pooja's leadership. Is also joining the CMS ecosystem as a friend of the network. And I really appreciate people making announcements out of little things like this, because it is good for the ecosystem to have people talking about it and showing their support. And that's what Pooja and NCPDP are doing.
Yeah, I think this is great too. Pharmacies are important. Pharmacies don't get a lot of love. And Pooja has been working with us for a long time, not even before NCPDP. So shout out to her. That's freaking awesome. We're throwing a party after the ASTP annual meeting, like after we're talking like the late night. Reach out to probably Melissa if you want to figure out how to get into that. And then we are going to Vive. So if anyone wants to like give us money so that we can afford our hotel rooms. That would be freaking great. Also, reach out to Melissa if you'd like to be on the show. We don't charge a lot for these spots, but they're really fun and we give you a lot of exposure. So reach out. It's cool. All right. Anything else, Lisa?
Fantastic.
What's going on?
That's it. That's it.
All right. So now we got this guy, Brian Lane, CEO of Wellink. What?
He's here. Brian, you're
He's
unmuted.
here.
You've got to unmute yourself, bud.
I'm unmuted, but can I play the game of having technical errors just like
Absolutely.
Kat?
Listen,
If you can compete with Kat, then
I don't think you can beat me.
You had like 15 there. It was pretty impressive.
I know. I racked him up on this show. Yeah.
You did. It was good.
Yeah.
But I do love the slide of both of you with the bald eagles. That was that's a stellar piece. Absolutely.
Yeah,
stellar.
it's definitely. Yeah, you'll have to stay tuned. We have great ones every week. They're always super good.
Love it.
But yeah, so Brian, what's the story here? So Wellink used to be the Center for Health Affairs, used to the kind of the Ohio Hospital Association. Like, tell us what even is going on here. Who are you? What is Wellink? Oh my God.
There you go. Well, let's start with the first question, which is I'm Brian Lane. I'm the president and CEO of Wellink. Wellink was formerly known as the Center for Health Affairs. And before that, it was the Greater Cleveland Hospital and Healthcare Council. And so it was created in 1914 within Cleveland to help actually create, build, subsidize, and support the hospitals and healthcare systems of the Northeast Ohio area. And so it was one of the first hospital associations, first healthcare associations within the market, created during a period of time where the GDP of Cleveland was really, really high, Kat, and the need was to keep bolstering out, the services and the populace and support them. And so now there are 37 hospitals, around 4 to 5 core healthcare systems within this area. And we're now evolving into supporting all providers and having them actually sit at the table to have one voice. And by doing that, that voice becomes a little bit stronger for resonating on advocacy issues. You just put up a whole shitload in the last 40 minutes, which is awesome. I love your opinions and also teasing of it as well, because it is confusing. It's confounding. And most people can't make sense of it because it's very, very obstructively different than how we're currently thinking of healthcare, because it's cost containment. Yeah.
Well, so Brian, I saw on your LinkedIn, you came to this job from a position, I don't know, with some big company where you were directly working with HHS.
I was, and have core ties within the agencies and the optives still. So I had the luxury of working for Oracle and being the core representative for Health and Human Service, also serving as what they call a global client advisor, basically like a silverback, old school advisor for both DHA and VA, and became very, very close to the executive teams within the federal government for a number of years during the previous Trump administration. And actually, that type of relationship has actually yielded us some of our core board members. We've actually taken a former CTO, put him on to the board, and it was Ed Simcox. And then we put also Jose Arrieta, who I think that you guys.
Oh yeah, he came on our show.
We talked to that guy.
I don't think he knew it was gonna. He didn't know it was gonna happen.
Yeah, he is incredible, but he was in charge of about 67+ billion from an IT spend perspective, and literally changed the way procurement was being handled throughout not only the GSA but HHS overall, and deserves a significant amount of credit. And he's by far probably the most responsive CIO, because he held the keys to the whole domain of HHS during one of the leading cyber attacks. And I hope he shared that story. I did not hear the podcast on that, but he's the guy who shut down the system for HHS in order to enable it to still thrive when it was being attacked by billions of hackers. So yeah.
Wow. Do you think that's what's happening to me?
No.
Yes,
not.
you're being hacked.
I do not. I think that you have a connectivity issue just because of your internet provider, and we should
Who
all
is who
we should
who
do
is
like
your
a go-to fund and get you like
Mm,
additional receivers that will help you with your wireless connectivity.
Listen, I want to tell you that you are probably right, and you probably are. I'm on AT&T Fiber. I get those guys out like every month, and I'm like, fix this shit. My bill is like very many hundreds of dollars, and it's still jacked up. Like,
unbelievable.
Think about that happening to the patients, and that's the perspective we all need to go into our discussions with all of these tech providers, because the tech that's now serving us is also keeping us alive and keeping us healthy and enabling us to be able to correspond. If we don't have it, you can't have that. That's true. So true. Which is what we're saying it different ways. I'm saying a little bit more sarcastically from the standpoint of if it's down, it could really harm you. And so that's
strong agree. Hey, so tell us, I am always under attack, Matthew Holt. I am always under attack. Yeah, I mean, I do live in the South, so we just don't have great infrastructure down here. Because the North burned it so many times. We still haven't risen again. We'll see what happens.
Yeah, no,
we'll see. I mean, we do have Delta Airlines, as some of the best brands in America over here. I don't know what to say.
True.
Anyway, that is
not some of the best HIMSS members and HIMSS leaders are out of your backyard there. So I just want to put that out there as well.
Yeah, we do all right. We do all right on some things, just not all things. Anyway, hey, so tell us this, Brian. So you're representing a bunch of hospitals. You have friends in the
healthcare entities outside of hospitals,
just
meaning
broadly,
ancillary all the way down to FQHCs, government healthcare, senior care, long-term care, full
providers.
Suite.
The healthcare provider.
I like that. Yeah, the providers.
Yeah, don't worry. I got you. That's what I do for a living. So Brian said, what are how are hospitals feeling right now? What's the general vibe? Are they like, holy shit?
Confined, feeling of despair. Many facilities are not making the money that they used to because we've moved from a fee share system to a value-based system. Many are not prepared for the aha moment. The aha moment is you're getting constrained on the front end of your AR because you're not able to actually receive the proper receivables that you're due. Number one, because of denials. And so currently within the marketplace, and this is a really cool stat for you, it's taken from Premier, but 70% of the Premier GPO members have 80% denials automatically with their first claim. Okay. So that's an astounding number, and it affects not only the patient, it affects the institutions, it affects also all the suppliers and also all the vendors that are out there who have built medical supplies to actually serve all of us from a patient perspective. So my statement to you, number one, is they want to provide the best care they possibly can, but their hands are now being tied on financial constraints, regulatory constraints, and then with the changes of ACA along with Medicaid, Medicare, it is an upside down world. And so organizations that typically would deal with uncompensated care, and Lisa, I think you mentioned that, or I might have imagined it. Either way, organizations now are having to say, I've got to put constraints on that, and for the first time, which brings up a really big issue, which I think that at a later show, you might want to go down this pathway, and that is ERISA, right? And not ERISA, but EMTALA. I apologize. I was thinking about IRS versus EMTALA from a federal government. So the EMTALA piece, right, says you will actually serve those that are in specific need. Some facilities are not going to be able to service every single person that's walking inside the door, and they're going to have to come up with other alternatives of care provisions on the front end. And so, Kat, my statement is healthcare is in a survival mode. There's a tremendous amount of complexity. There's a tremendous amount of consolidation, as you got to hear at JP Morgan. And having attended that multiple times as well, you really never leave the hotel lobbies. um, but in that discussion of this week, the majority of those conversations wasn't just around AI, but it was the fact that more and more PE and more mergers and more actions associated with the consolidation is actually happening, from physician practices to large scale systems to hospitals going, hey, look, I can't afford to practice within this area anymore. I've now got to consolidate. I will shoot this facility off into other marketplaces. And so in this area, one of those examples with General Catalyst is actually Summa Healthcare in Akron, Ohio, which I think is a hell of an idea, right? Which is, hey, let's now support a community, right? Not let the facility topple and just die out. Let's actually put our best products, our best services, our best lines in, and then try to drive out the best optimal care that we possibly can and use it as our test bed to then go out and flower out into other facilities. Will it work? I don't know. We're going to find out. And I think these types of experiments are going to have to happen. I think people are going to have to partner and collaborate in a different way. So that's my
I guess, Brian, I would say I think that there's a question. There's at some point it's going to work, or someone's going to test it out. Where, let's say, a hospital or a health system says, okay, we see the way this is going, run uncompensated care. Okay, we see that no matter what, we're going to have to provide those, stabilizing services, and people are going to be walking in and out of our emergency room. At some point, you have to really proactively invest in things that divert and keep people healthy at the community level beyond the baseline requirements of, those community support funds or whatever else it is. So at some point you say, it doesn't matter what we do or if they are officially aligned to us or we have a contract or not. This growing base of people with uncompensated care who don't have health insurance, either because of Medicaid cuts or something else, whatever it is, we've got to get out there proactively, and hopefully we're able to keep bringing the cost down of things like that to be able to make those tech-enabled services cheaper and cheaper, so that if you're that health system, you just know that group of that percentage of the people who you're going to see are not going to have health insurance, and you've got to put the money up front because you're going to pay the cost no matter what.
Yeah, you are going to pay the cost no matter what. And the shareholders, with the shareholders, including us who have 401ks and other funds indirectly, or
you can give up your nonprofit status, back to the IRS. If you want to keep your nonprofit status and you want to think about your mission, some of these places are religious institutions, it's a ministry, and they have a deep mission they have to fulfill. But also, if you got that nonprofit status, you should think about how you can serve the entire community. And just like, here we are, right? There's a bunch of challenges there, but like,
I do want to know, having been in this field, this from an administration standpoint, as well as with the associations, hospitals do lean into their communities. They give a tremendous amount of services across the board. Can there be done? Can there be more? Absolutely. I don't disagree with that at all. But I also think communities have a stake at it as well, in the sense of.
Well, you said ERISA, Brian. I mean, employers are like a really, I would say, an important partner in those. If a hospital has been saying like, okay, guys, we have a big problem. We need local government. We need employers. It probably can't be done alone, right? Like you said, of course, these hospitals already have community programs, but they got to get all the partners, right?
They do. And that's the collaborative piece of this, honestly, Lisa, that's got to come into play. And organizations have to reach across the table versus looking at themselves as, hey, I'm all inclusive, versus looking at the CBOs, the FQHCs, and going, hey, you're in a different realm, different world. Actually, they're part of that same network. And that's why I'm telling you openly why we made the modification and change to our bylaws to actually create the new models to actually support that. And that's nice. Never been done here. It hasn't been done in other areas and arenas, because people want to keep that finite protective area, which is what Kat was alluding to in the T's of the question. And I appreciate it immensely because it has to be done. And it's that forward thinking versus the reverse. Let's just protect our turf. Let's protect our turf. Yeah. Protecting turf doesn't get you shit.
Brian, can I ask, you mentioned that many of your members are freaking out in some part or in large part over the move to.
I ain't just even members, Kat. I mean, all facilities are in a very tumultuous period of time. Absolutely.
And in part because of the move to value. So we know, like, generally, the feds and others are looking at some of the value-based care programs and saying, like, ooh, do they really work? Like, what do you think we should continue driving towards a value-based system, or do you just think we should scrap it?
I think you have to, because what Lisa just said is correct from the standpoint of prevention is cheaper than the acute side of the house.
Just is.
So if you're walking into an ED, you're automatically hitting the till 30,000. 30, 40.
And if you're not going to get any reimbursement for that because someone is, totally uninsured, or, someone is super housing insecure, living on the streets, whatever it is. I mean,
and they ran out of that $1,000 government Benny in their HSA.
That's right.
Week.
Their HSA is gone.
HSA thing is a really that's an oddball piece. Not that I'm against HSAs. I have an HSA.
No, I love HSAs.
But it's something to lean upon and draw upon when you need it, or let it grow. But man, oh man,
mostly let it grow. Just to be clear, HSA is a fantastic tax-free way of for rich people to stock their money and then use other money to pay for healthcare. But just saying. But it's not going to solve this problem. It doesn't solve most people's problems. If you had, let's say, 2 pretty high acuity emergency room visits and that became 1, you've already saved a huge amount of money, right? And 0 better.
100%. Yeah. And that's the reason why the CBOs, and actually I'm going to use the taxonomy and vernacular of Wright Lassiter from Common Spirit. He was at the AHA Leadership Summit, and he said very openly, he goes, it's not about the 4 walls of the hospital anymore. It's about the whole care continuum. It's about that outreach. It's about making the connection. It's about serving the people within your community and enabling your organization to do it better in the communication, the outcomes, the reach, the direction, the navigation, in order to actually thwart the use of the acute facilities. Not saying 100%, but until you definitively need it. And then it's the use of sensors, telehealth, telemedicine, and having that direct dialogue with people from the home. So it's hospital to home, right? It's that personalized, customized care that people are now expecting, right? Not because of Black Eyed Peas song, but because that we all have been ingrained in our heads that we have the capability of asking for more. And asking for customization. And so our expectations are higher, but we don't have a financial budget that allows folks to have that pure flexibility across the board unless you build a true tiered-based system of haves and have-nots, right?
Mm-hmm. Yeah.
This is why Lisa's statement of, hey, Medicare as a baseline for everybody, right? Right. That makes sense.
Kat agrees too. Weirdly
I agree.
enough.
This is one of my socialist ideas. I'm very pro single payer. I think it should be administered.
It's just the second you start posting those prices up on the screen. First of all, it's incredibly complex. Like a price for a particular individual service or procedure is just one factor of the entire bill. Fine. I support that. I support transparency. But pretty quickly, we're going to say, why would I be paying 1.5 to 10x or more Medicare when you're giving that same service, probably being nicer to the Medicare beneficiary? What am I doing wrong here? How do I turn 65? Good luck. I love it. Love price transparency. It doesn't solve the problem on its own.
Yeah, but it does give you the power to feel like you are empowered. And it also does give you the power to make choices, right? Or choices of where you want to go.
Maybe if there is a place to go. That's the problem, is that, I live in a place that has very minimal access to care for a very rich place, but it's still better than a lot of places in the country where there just aren't many places to go.
Yeah, well, they're becoming more and more less, right?
Yeah.
That's how
I
I
don't know.
said
Like
that. More or
I'm
less.
pro-transparency. I'm pro-choice in all things. I'm pro-freedom in everything. But I just don't think, like, it's like a weird artificial market, right? Like, I think it's good to move toward that. I don't think it's a true solution. But
Yeah,
you know,
it's tough.
hey, but Brian, we have just a few minutes. Unfortunately, Lisa does have to go to her real job at 4 p.m. our time anyway. AI. So JPM, it's like all the AI all the time. The administration is driving towards like mass AI adoption. We've got lots of programs coming out of CMI.
Can I ask you a question? Did everybody out there still believe that AI just happened? Right?
No.
And that we haven't been living in AI for like the last 25 years. Have you been?
No,
have you still seen those people? That's the.
No,
Those
I mean, it depends on who you talk to. It depends on who you talk to.
Scream at because it's so humorous. Like your whole life has been around AI for the last 25 years, from banking, from following a map, via your computer or your phone, your online presence. I mean, your stats associated with your social media. I mean, it's humorous to me that people believe that, hey, AI was just invented and we need to stop the actual use of this. It's already, it's out there. We're living it. We're dependent upon it.
100% totally. But some of these newer point solutions, right? Like for healthcare, for hospitals, and your provider community in general, what is the general vibe in the provider community about adoption of AI?
Well, one, there's fear and there's animosity. You got to remember, healthcare typically has a 5-10 year type of lag associated with other markets, right? So that's the first data point I'll throw out there. I think that hospitals and healthcare systems are searching out, trying to differentiate themselves, and then the leaders are going, "Hey, I need to actually do this in order to actually curtail costs from an operational perspective. But where do I start?" Then, when it comes to patient privacy as well as employee privacy associated with this, that's the fuzziness, the gray area that still has to be fully, figured out. And I'm not saying standardized, but I'm stating it needs to be shaken out, better. Many organizations believe that their, small little LLM activity is going to set the world, and I'll use your bird here, on fire, and that they're going to set themselves apart. And the reality is 100 other facilities are doing the same damn thing, right? And so at some point, all these different solutions need to actually be accentuated and shared, similar to what we all did back in the 90s, including, simple web development portals, logic systems, database, document management. It's the same type of thrust where we're gonna have to shake out who has that best solution and then push it out within the marketplace to create better optimization versus, hey, I got to hire 10 to 15 developers or another team to actually create something that everybody else already has.
Yeah. Love it. All right, Brian, one last thing for our loyal fans, and then we're going to get out of here and go to the weekend. Well, I am. Lisa's going to keep working.
Okay.
Last statement. What do you want to tell our loyal fans?
Last statement.
Where people will find your stuff.
Yeah, you can find our stuff. I mean, you can just look up Wellink, but we're about literally connections, folks. And you're going to see us move more and more nationally. And what I want to say to everybody is breathe, smile. It can and will get better. And those are the two things we all can control. And so
amazing.
Right. You and John Gorman on the internet talking about being positive. Love it.
Pranoa.
All right.
Thank you, Brian. Thanks, everybody.
See
y'all soon.
Bye.
See y'all later.